Welcome to the press briefing. We have Dr. Chuang Chuk Kwan, Head Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. Dr. Chuang will first give you an update on cases. Good afternoon. Yesterday, there were 2,743 PCR positive cases reported yesterday and 3,086 RAT positive cases. So in total, 5,823 confirmed cases. And since the start of the fifth wave, we have a total of 1.15 plus million cases, and 725,257 cases are PCR positive cases, and 425,350 cases are RAT positive cases. And among the 2,743 PCR cases, 361 were reported by the Hospital Authority, 489 were tested positive by the Public Health and Laboratory Services Branch of the Department of Health, and then 1,893 cases tested positive by private contractors. And among the cases yesterday, for 1,135 cases, the CHP conducted tests on the variant strain, and then there were no cases that tested positive for L452R, and 1,229 cases tested negative for L452R. That means these are Omicron cases, and for 6 cases the viral load is too low, or the cases are still pending results. Yesterday, 3 imported cases. The 2 aircrew members that came from Hong Kong from Bahrain and Canada on the 31st of March. And there's 1 case of imported cases. The patient came from Germany on flight QR818 to Hong Kong. There are new cases involving residential care homes. For affected residential care homes, there are new cases, but it's just about 100 cases. On the number of death cases, the Hospital Authority has reported another 116 cases, death cases where there's a report on a positive sample. And so far, 7,679 death cases there are. And then 4 cases reported by the forensic scientists, aged 61 to 94. They had underlying conditions, and on the 7th, 17th, 18th, 20th, these patients passed away. For these 4 death cases, the cause of death is suspected to be related to Covid-19. As for cases reported by forensic pathologists, there are 51 cases, 19 female, 32 male, aged between 51 and 58. 7 were residential care residents. Most of them had underlying condition. And then for 5 cases, the cause of death may be related to their own underlying conditions. And for 8 cases, we couldn't classify the cause of death. For 38 cases, the death was probably related to COVID-19. And for the 5th wave of the epidemic, there are a total of 7,732 death cases, 3,139 female and 4,593 male. The age range is from 11 months old to 112 years old. A median age is 86. And there are still 8 cases involving those under 18, and about 96% of the cases are those aged 60 or above. And then 55% of the death cases involved residential care home residents. The death rate is 0.67%. I would also like to mention other issues. For the rapid antigen test positive cases, we have done some random specimen investigation, which speeded up certain processes. So on the day of confirmation, SMS will be sent to the confirmed patient That is, if the person's reported his or her case on the platform, and then the next day the contractor would send the sample collection tube to the home of the patient. Usually this will be left outside the door. There will be no contact with the patient, and then the patient will be asked to take the sample collection bottle, and then they could then send the sample to the laboratory for test. This will speed up the process. So because now we usually will make a call the night before, and then the next morning we'll send SMS. Instead, on the day of confirmation of the case, an SMS will be sent out at once to the confirmed patient. So please note this new arrangement. The Food and Health Bureau issued a press release 2 days ago that there have been heavier penalties in relation to isolation of patients and quarantine of close contacts. Now, if people have to follow the isolation and quarantine order, if they do not follow these orders, it is a criminal offense. The maximum penalty is $10,000, which is level 3 fine and imprisonment of 6 months. So we ask the public to cooperate with us, because this is a measure to prevent the spread of the disease in the community. That's all from me. Dr. Sarah Ho will tell us about the hospitals. Good afternoon. There are 10,298 confirmed patients in various public hospitals. The North Lantau Hospital, Hong Kong Infection Control Center, the Hospital Authority Infectious Disease Center, and the AWE Community Treatment Facility. 30 patients are in critical conditions, 24 in serious conditions, 79 of the critical patients are in ICUs, and as at 00 hours this morning, in the past 24 hours, 96 patients who tested positive to COVID-19 passed away, 49 males and 47 females, aged between 38 and 103. Among the patients that passed away, 52 came from residential care homes, 59 had no vaccination record, 27 had 1 dose, 7 had 2 doses, 3 had 3 doses. 92 were aged 65 or above. A few of the deceased patients were relatively younger. One, a 39-year-old male, he received a consultation at the mental ward, and then he tested positive on the 17th of March. It was RAT. He was disturbed and he actually hurt himself, and so on his hand there were injuries, and he was sent to the accident emergency ward of the Princess Margaret Hospital, and then he was transferred to the orthopedic ward, and then antibiotics were prescribed to prevent infection of the wound, and other medication was prescribed, but then the condition of the patient continued to deteriorate. On the 28th of March, at around midnight, the patient's condition worsened. He had to be sent to the ICU. At the time, intubation was needed. When the patient was in the ICU, there was serious pneumonia, and also pulmonary obstruction. So ECMO had to be used, and also blood solvent, and then steroid remdesivir and so on were described, but then his condition continued to worsen and passed away, unfortunately, on the 31st of March. According to our record, the patient had 3 doses of the Sinovac vaccine. The case was referred to the coroner for follow-up. Next, a man, 45 years old, There's been metastasis of his terminal cancer. Another patient is a 58-year-old male. He had various chronic diseases, and he had to have renal dialysis. And because of backlog in data, today we would report that between the 19th and the 30th of March, there were 20 patients who passed away, but that's not been announced. 10 were male and 10 were female, aged between 55 and 102. And in the past day, 1,473 patients recovered and were discharged. 5 patients tested positive upon admission screening. 6 patients in the same ward will be listed as close contact. For staff members, so far 21,203 staff members were confirmed cases. 19,013 have recovered and have returned to work. So that's all by way of report. So the floor is open to questions. Please first identify your organization before you ask questions. Thank you.
The reporter over there. Good afternoon. I'm from Cable News. About the first deceased patient, the 39-year-old male patient. Was he 39 or 38 years old? Because you mentioned both ages. So would you please clarify his age? And you said his situation deteriorated, he self-harmed. And what was the reason for his deterioration? Was it because of COVID or other reasons? Is there a preliminary result? Now, in the UK, a new variant is found. That is Omicron BA.1 and BA.2, a combination of the 2 variant strains. There are some 600 new cases in the UK. According to research, the transmissibility is about 10% higher. Now, with the flight ban lifted, UK flights can come to Hong Kong. So are we worried it would pose a stress on the prevention of importation of cases and pose more risk of a rebound? Now, for those who were infected in the 5th wave, would they be infected with the new variant again? So how can we prepare against the outbreak of a new wave? Now, the third question, RAT, the chief executive said we would use the RAT kits in the anti-epidemic service bags to find out the infection situation in society. So how does that work? Can you give us more details? And also, some doctors estimate that the percentage is about 5%. So is it really useful to find out the situation given the infection percentage rate? And what about the reporting requirement? Sorry, there was a mistake. The deceased patient was a 38-year-old male. On admission, he was tested positive on RAT. He was prescribed with antiviral drugs. Still, his situation worsened, and he had pneumonia and pulmonary blockage. So that's related to COVID. Now, in the UK and also the WHO, it is reported that Omicron XE or XD combined virus strains that were found, possibly a combination of Omicron BA.1 and .2. It is being investigated whether the new variant would lead to a more serious infection, and also whether it is more transmissible. Back in early February, the University of Hong Kong has found an imported case with the XE strain. They were 2 visitors, and they were found upon arrival at the airport. The strain did not enter our community, and it was they were imported cases. We will closely monitor the developments in other places, as well as the latest announcements from the WHO concerning new virus strains and whether it would pose a risk to Hong Kong. I don't have the information right now. That's according to the University of Hong Kong's research. Back in early and mid-February, there were 2 travelers with these strains. Whether the strain is really more transmissible and more prone to cause severe illnesses, we have to wait for more analysis. We will look at the studies in other places. Concerning RAT, I don't have any updated information. Next question. The gentleman in the shirt. I'm from TVB. Starting today, public service will resume gradually. More companies are asking their employees to come back to work. Now the daily infection number is on a declining trend. We expect the trend to further climb down. However, are we worried about a rebound? The overall trend is a downward one, judging by the figures. And there are a number of people infected in the community. So the virus is not very. The transmission is not very serious. However, we still have some 5,000 cases each day. With more activities and more people on the streets, there is a chance of rebound. Next question. Good afternoon, Hong Kong 01. There are reports that it takes half a day to prescribe medicines to people in holding centers. Dr. David Lam said the procedure is too slow and we should speed up the prescription at holding centers. So are we happy with the half a day's prescription time? Would you take into account Dr. Lam's advice? Now, Qingming Festival is coming. There will be a grave sweeping activities tomorrow or the day after tomorrow. Previously, after Chinese New Year, we had a lot of outbreaks. So would you advise people against going out, and how can we prevent causing infections? And also the flight bans and the quarantine. Flight bans have been lifted, and the quarantine period is shortened to 7 days. Now, with the advance of the new virus strain, that is the combination of BA.1 and BA.2, it's 7 days enough. Is there a risk? Now, for festivals, if you go to crowded places with many people, of course, there would be infection risk. So we should try to stagger our activities and go to less crowded places or avoid the peak of the festivals. And also, when you go out, you should avoid taking off your mask. We will pay close attention to the characteristics of the new strain, whether it would pose a risk to Hong Kong, and see whether we have to adjust our measures. For holding centers, there would be a public hospital nearby. If the doctors consider antiviral drug is needed, the pharmacists in public hospitals would be alerted, and we would prescribe the drugs promptly. There are procedures to follow. At the holding centers, we may not be able to set up a pharmacy department. However, we will try to speed up the procedures.
Next, the one in red, the gentleman over there at the back. I'm from Orange News. I have the following questions. The government studied the possibility of using RAT to find out about the level of infection in the community, but then Dr. Zhang Keiyam is concerned that the people may not report their cases, and then there could not be an accurate gauge of the level of infection. So, are there any ways to make sure that people who test positive would actually report their cases? Now, you mentioned a 38-year-old patient with a mental illness, and when he saw that he tested positive, he became disturbed, and then he, did something that hurt himself. That hurt himself. Now, usually for patients with mental illnesses, if they become infected, what is the impact on them? Usually both mentally and physically. And are there any services to give support to such patients and ensure their mental health? For the mass RAT test, I don't have the details. But actually, people could take the RAT at home when they worried, or they know their family members are infected, or they know anyone who's been infected, or they've been to high-risk places. And if they test positive, we hope they will report their case, because they may have to go to work or to school. And if they report their case, they fill in information, then we could issue isolation order, which they could then give to their employers. Because if they just stay home, they won't get such a proof or documentary proof. The hospital authority has set up hotlines. If people have any questions about COVID-19 vaccine, like if they don't feel well or they have any emotional issues, they are welcome to call these hotlines. The one in a white shirt, I'm from News. First question, since the start of the fifth wave of epidemic, over several tens of thousands of children were infected, and 8 children passed away. The Hong Kong University has surveyed 1,147 children. 4 died from, and so that's the death rate is 7 times that of common flu. So there are measures now to promote vaccination among children. So as you promote vaccination among children, do you have any other publicity effort? Second question. Dr. Ho Pak Leung from the Hong Kong U Infection Center said that now if we want to achieve the best result of mass RAT, we need to step up publicity. For many elderly, especially those living on their own, they probably cannot take the RAT properly. So if people are asked to do RAT, how are you going to give support to these hundreds of thousands of elderly residents? Let me take the question first. I understand the relevant parties are doing much promotion for vaccination for children. Say in schools, there are outreach teams, or book appointments can be made with doctors or vaccine clinics. So there are many quick and easy way to get vaccinated. Hopefully then we could boost the vaccination rate of children. Of course, children are to resume school soon, so vaccination would help to lower the risk of infection in school. As for the elderly, yes, I understand the government has also taken various measures to facilitate the taking of RAT by the elderly. Now, for example, if there are other family members, of course they could help out the elderly. I understand the relevant party is considering that aspect, but I don't have any details with me. The one in black, the lady over there.
The South China Morning Post. First, we'd like to ask about what the health authorities know about the Omicron XE and XD variant. How has Hong Kong been tracing that, and has there been any reported cases so far of it? And if it is detected, what's the protocol for that? And can both doctors explain the death number again today? How many were reported from HA, and how many were backlogged, and how many were found in a mortuary? It wasn't too clear. Thank you.
We understand some countries, they found some recombinant virus, and this is also closely monitored by the World Health Organization. And the transmissibility and the severity of this new recombinant variant is still being investigated. So we will closely monitor the latest situation. And according to the local monitoring, we understand from Hong Kong Youth team that there have been 2 travelers with recombinant BA1 and BA2, the so-called XE recombinant variant, have been found among travelers in early February, among 2 travelers who are detected in the airport. And they have been isolated and treated, and there have been no other similar variant detected locally.
Death cases. So in the past 24 hours, and there were 96 patients have a record of COVID positive tests passed away. They are 49 male and 47 female. And due to the deferral of data entry, so there were additional 20 deceased not yet announced. They died from 19th to 30th in March, including 10 male and 10 female, aged between 59 to 102.
Next, the one at the back, please. I'm from Now TV. Now we've seen media reports when the public are interviewed, they asked if they're worried about the epidemic. Many said that, well, they've recovered after they've tested positive, so they're not worried about going out. Now, of course, there will be the Qingming Festival and the Easter break. There will be many holidays. So are you worried that this is the attitude of the public, and so more people may go out, and that may cause a rebound of the epidemic? Are you worried? Now, according to the 2 universities, their projection is perhaps several millions of people have been infected in Hong Kong, but still that means there will be a few other million people who have not been infected. And even if people have been vaccinated, there is the risk of infection. Of course, if we get vaccinated and if we get infected, then the risk of the condition worsening or the risk of death is lower, and that's the benefit of getting vaccinated. But then if people go out, of course, there will be a higher risk of infection, so people have to pay attention to that. Last question, please. I'm from Ming Pao. Dr. Chuang, do you have a figure of a review of RAT result that is the false negative positive cases? Have you found that for PCR test cases actually test negative? So what are the usual mistakes the public commit as they take the RAT? Starting from tomorrow, you're going to distribute RAT kits. Do you have any advice to the public as to how it can be used? Do we have to do the test every day? Or among family members, if some family members who've been infected recently, maybe they don't need to take the RAT. As for others who need to go to work, perhaps they can take more RATs. And as for cases imported at the airport, do you have initial figures for today? Now, of course, there's no data, genetic sequencing for all cases, but for the imported cases coming through the airport, would you do genetic sequencing on all these cases? So you could monitor if there are new variant strains. Now, for cases reported by forensic pathologists today, are there cases from homes, or for other cases did they involve people who wanted to be sent to hospital? And for the forensic cases, it seems there's a relatively large proportion of cases possibly related to COVID-19. So is there a difference in this situation compared to the cases of the hospital authority? Maybe for the forensic cases, because people didn't get admitted to hospital, so they didn't get support, and that's why more of them died of COVID. Now, we don't have the figure for imported cases for today. As for the spot check system of RAT test results declared. Now, if there are for those cases with 2 negative results, there are about 190 cases. That's so far the number we have got from the test we've done, the review test we've done. That means it's a percentage of under 2 to 3. percent. And of course, even with our tests, there could be false positive or false negative cases. You might have heard from Dr. Au. Maybe for someone, they did not do the test on that day. They did it a day or two before, but then they wanted to declare the case, so they claimed that they did the test on that day, and so by the time maybe the viral load is already small, so that's why when we do the PCR test, it becomes negative, and these cases will then be discounted. For the forensic cases, they will first do screening, say for people who fell from a building or who died from accident. These cases will take it out, and then so the result they gave us is either die with or die of. Maybe the death is related to COVID somehow, but for the die of cases, these cases will be put further ahead on the list under the cause of death. For residential care cases, there should be some. There's a case that tested positive on the 5th of March. They tested positive on the 2nd of March, and the person that passed away on the 5th of March. As for the situation you mentioned, you're talking about the number of the ratio of X-ray cases in our cases. We have to wait till hospital authority to do all the analysis before we have any result. Now, if I could follow up for the 38-year-old patient who passed away, the day he's admitted to ICU was the 25th of March. And then you asked how we are going to monitor the genetic analysis of imported cases. For all cases found at the airport, we would do the sequencing, so we could find out about the variant strains involved and whether there is anything peculiar, and then the laboratories will do a full genetic analysis. So we do monitor the situation. Sorry, the speaker is not using microphone. Well, there should be more than 20,000 cases. That's the end of the press briefing. Thank you.